Hi everyone, welcome back to another episode of Public Health Progress. Today we're going to be talking about the prevalence of liver disease in Vietnam. Cirrhosis and/or liver disease is the seventh leading cause of death in Vietnam, according to the CDC. By 2025, there will be 60,000 liver cirrhosis patients, 25,000 liver cancer patients, and 40,000 liver disease related deaths in Vietnam, according to the scientific workshop on strengthening treatment capacity and prevention. Okay, so first we're gonna go to a little bit of a history lesson. So during the Vietnam War from around 1962 to 1971, almost 10 years, the United States sprayed herbicides, most of which were this chemical called Agent Orange, across Vietnam as a military tactic to control vegetation during Operation Ranch Hand. Agent Orange contained many toxins, namely hepatotoxins, which are toxins that affect the liver, such as 2,4-D, 2,4,5-T, and TCDD. Agent Orange is to blame for many health complications that have lasting effects even today, such as cancer and birth defects. And there are also huge implications that suggest that Agent Orange are the culprit for the prevalence of liver complications in Vietnam and Vietnam War veterans. In a study looking at liver damage in Vietnam War veterans, it was found that liver abnormalities were closely related to months of exposure to Agent Orange. To add to this, alcohol is a huge part of the social life in Vietnam. Many social gatherings include drinking beer or taking shots for fun, and all of these activities are completely okay as long as they are safe and legal. Currently, the drinking beverage and alcohol liquor industry is prevailing in Vietnam. Vietnam actually has the largest beer market in all of the Southeast Asian nations. In a 2019 study, alcohol consumption in Vietnam increased a staggering 90% from 2010 to 2017. And according to a 2023 study conducted by the University of Western Australia, 77% of adult males drink in Vietnam. And by the way, this adult label included people aged 15 and above. Alcohol consumption was also statistically higher in rural regions of Vietnam and in lower income households in Vietnam. Also in Vietnam, alcohol causes over 11,000 liver cirrhosis deaths, over 6,000 road injuries, and over 3,500 cancer deaths per year. The most recent alcohol policy update for the Vietnamese government was in 2019, and the policy included prohibitions, including selling to minors and advertising alcohols that had strong ABVs, and by the way, that stands for alcohol by volume. the policy also restricted alcohol consumption in certain places or times, and restricted ads of specific ABVs in certain places. Alcohol ads in Vietnam also have to have specific warnings and age filters, and requires an age declaration when buying alcohol online. I also think it is also very important to note that multiple parties played a part in making these laws. So for example, there were multiple transnational alcohol corporations and representatives of the alcohol industry that were also involved in the policy making process and participated in lobbying during the development of this bill. And I tell you this information because factors such as that, or such as policymakers or parties that particularly focus on the economy have quite a bit of sway and voice when it comes to making these policies, and that can ultimately have an effect of what these laws become to be. So I say all this to explain that alcohol is arguably one of the biggest risk factors when it comes to liver disease and cirrhosis. So I'm gonna kind of explain this in like pretty simple terms, but basically a function of the liver is that it helps break down alcohol in the body, and during this process some of the liver cells die, and the liver is capable of regenerating new cells, but over drinking affects this regeneration ability, and over time, the liver will not be able to regenerate new cells as quickly or even at all. So health concerns such as alcohol abuse often leads to inflammation of the liver, which is also known as hepatitis, and this can then easily lead to cirrhosis, which is basically irreversible liver damage and scarring. Liver disease can really easily become a chronic and irreversible issue. Treatments for cirrhosis includes treatment for alcoholism, medicine for pain, scarring, any complications a patient might have, but lastly, of course, is a liver transplant. I really feel like I can't talk about transplants without the issues that kind of always come with it, just because of the nature of our global healthcare system. But more often than not, there is a much higher demand for organs than there are organs available, and additionally there are a bunch of criteria to meet when looking for the right organ for a patient. For example, the organ has to come from a person with the same body weight, or around the same age, the same blood type of the patient who needs the transplant, and relative location of the patient and or the organ donor, and the priority slash need of the transplant for a specific patient are also huge factors that are considered when it comes to the transplant matching process. And I say all this to bring up this next issue, which is illegal organ trafficking. So when the demand is so high, this is just something that a lot of people turn to. So Asia News reported this February that illegal organ trafficking has increased in Vietnam due to low organ donation rates, and illegal organ trafficking is bad for plenty of reasons, but I think mostly it's because it's very unsafe and provides a lot more benefits to the brokers rather than the patients at hand. So in response to this information coming out, there was a public health conference in Vietnam, and a multitude of kind of approaches to help solve this issue were suggested, and so some of them included offering both in-person and online registration for organ donation, raising awareness of the meaning of organ donation, and avoiding direct contact between the organ donor and the organ recipient, and lastly creating an organ donor status space on legal licenses to kind of increase motive for people to donate. Okay, so that's all I have to say for today. I really hope y'all enjoyed watching this episode. I think it's kind of different from the type of things I usually talk about, and it was like kind of more like a really specific case study, so please let me know how y'all liked it. I'm actually Vietnamese, if you didn't know already, but I try to visit Vietnam every few years or so researching for this podcast episode was super interesting for me, and I learned a lot from it, and I hope y'all did too. But yeah, okay, thank y'all so much for listening. Bye guys.